Mga ka-nation, siguro naman by now we all know what to do in the event of a medical emergency, diba? Tatawag lang tayo ng 911 and no matter what time it is, dadating yung ambulance to take us to the hospital. But what do we do in case of a dental emergency? Kung mawalan tayo ng filling, kung mawalan tayo ng crown or pustiso or ngipin, most of us don't have access to a dentist who's on call 24 hours a day. So, here with some first aid tips that will help alleviate our tooth trouble, at least until we can get to the dentist's chair, is our dynamic dental duo from G Dental Group. Please welcome back to our studio, Dr. Raemund Galang and Dr. Camille Corvera-Galang. Hi, guys.
Hi, Michelle.
Okay, so dental emergencies.
Yes.
Ano ba yung pinaka-pangkaraniwang dental emergencies na nakikita ninyo?
The most common thing that we see in our office is gum swelling.
Okay.
Usually nasa area ng third molars.
Or yung wisdom tooth.
Okay.
Dahil nasa dulong-dulo na siya, no?
So, bakit siya nagiging emergency?
Well, usually after they eat something like popcorn or nuts,
Or chips. Biglang
butong pakwan,
Nako.
you know, di ba?
Favorite pa naman yun ng mga
Naiipit yan sa area ng wisdom tooth mo, and then it gets very swollen, namamaga, masakit, to the point that sometimes parang hindi sila makakain on that side. They can't even open their mouth very well.
So
they
yung
start calling us.
pangpa-diet din pala yung butong pakwan na yan. So ano yung solution? Like if for example, you're not available or they're far away, they're on a trip, biglang magmaga yung gums nila.
Well, first they have to try to clean it very well first.
Okay.
No? And rinse with salt water solution.
Okay.
The salt and water, the good thing about this is meron siyang parang antibacterial effect ng konti. And then, you know, it lessens the bacteria in that area.
That's parang the advice of every lola, diba? Salt
Oh,
and
yeah.
water.
Yeah, it
Salt
is.
and water. And it's true.
Okay.
Are there any don'ts? Ano ba yung mga dapat iwasan?
Of course, you don't want to pick on the area. Huwag mong gagamitin yung toothpick masyado. Kaya yung paper clip, para lang tanggalin yung kung ano yung nakasaksak doon. Okay?
So don't try to do a homegrown dental visit.
If it doesn't go
by
in
yourself.
mga 2 days, it's time for us to take it out and clean it for you.
Okay, so 2 days is the maximum. All right. So let's move on naman to fillings, diba? Literally, yung fillings is to fill in your cavity.
Tama.
But it's happened, I mean, and I know people who it's happened to, na biglang natatanggal sila.
Yeah.
So what do you do then?
Madalas nangyayari yan, natatanggal yung filling o kaya nagka-crack, no? What you can do, you know, bawa, you're somewhere, you can chew gum, you know, sugar-free gum, and then you can use the sugar-free gum, and then ilagay nyo dun sa butas kung saan natanggal yung filling.
So pwede mo siyang itapan
Yeah,
with sugar-free
make sure
gum.
sugar-free,
Okay.
And then also, if you have an access to a pharmacy, get yung over-the-counter na dental cement.
Okay.
Okay?
Para lang siyang Play-Doh.
Play-Doh, and then you
okay.
stick it in the area.
And that's easy to find.
That's very,
relatively easy to find.
yes.
Okay.
And then
drugstores.
avoid eating on that side, okay? Kasi baka mamaya, weak na pala yung ngipin, pwede mag-crack pa yung tooth, o kaya mag-crack pa yung filling. Yeah.
Speaking of cracks, I
Yes.
know that, siyempre, lalo na sa ating mga ka-nation, we like to crack things with our teeth. Alimango,
time.
alimasag, shrimp, everything na.
Yeah.
So, and I'm sure, and it's happened to me, na the cracks create little cuts in our gums, in our
Tama.
cheeks, or even in our tongue.
Minsan, malaki yung cut, namaga,
At dugo ng dugo, minsan hindi tumitigil yung pagdudugo, okay?
They have to apply pressure on the area.
Okay.
They can use gauze or something very common sa household is tea bags.
Wow.
So any plain tea, what they
Just
do is
moisten it.
moisten it in a little water and bite on it.
Put it in that
Wow.
area.
Why tea? Tea
What's
has tannic acid, which is a vasoconstrictor, so tinitigil yung pagdugo. Bite on that for about 30 minutes, it will stop
30
bleeding.
minutes.
Yeah.
Okay. Well, we actually have a video question from one of our viewers. So, tingnan natin kung anong tanong niya.
Hi, Dr. Ray and Camille. I have a loose crown, so can I just super glue it back to my tooth?
Wow.
Wow, super glue. You'll be surprised. Ang daming nagtatanong yan. They always use super glue. The answer to that question is no. Super glue is not recommended.
No.
No. Kasi
No.
hindi naman yan designed para gamitin
Para
sa...
In fact,
bibig
diba,
nyo.
it says in the
Sa
label, do not
do
ingest.
swallow, do not ingest.
Right.
Yes.
The toxicity, hindi natin alam if it's safe. Next, it also releases heat. So, pag nilagay mo yun sa ibabaw ng ngipin mo,
It can damage,
it can damage your gums
nerve.
and your nerves of your teeth.
So what's the right thing to do?
Something better is a denture adhesive like this, again, over the counter in any drugstore. It's like a paste. You clean your crown, lagyan mo yon, and then try to put it in place
Okay.
sa ngipin. Ngayon, kung nasa likod naman, it doesn't hurt you, wag ka na lang muna mag-smile. Until you get to see us in the office.
Magpa-demure.
Yes.
Unless, of course, yung iba nasa cruise, no? So,
Okay. Well, basta, wag mag-MacGyver when it comes to doing your teeth.
super glue
Do
has
not
no
be a
role
hero.
in dentistry.
Right. Well, thanks again for all your advice, doctors. Can you please tell our Canation kung saan kayo mahahanap?
Well, you can find us at 901 Campus Drive here in Daly City, California, or you can visit our website at www.gdentalgroup.com. Give us a call at 650-991-7055.
And you can find us on Facebook too. We have a Facebook page.
Follow them on
There you go.
Facebook. All right, you guys. Well, I'm definitely going to look at tea and and super glue in a whole new light. Thanks again for joining us. May adobo pa tayong parating, so stick around.